in looking at some of the epidemiology of allergic rhinoconjunctivitis. So it can affect up to 40% of kids and 30% of adults in the US. And this is a study looking at the epidemiology of both ocular and nasal allergy in the US. And as you can see here, the South here takes the cake. So compared to other regions, that is the highest percentage of folks having ocular and nasal allergies. So, this is a big burden, not just in terms of cost, but, there's a lot of clinician visits involved. There's a lost school days, up to 2 million lost work days, 6 million work days lost per year. There's about $2.4 billion spent on prescriptions and over-the-counter medications. And rhinitis occurs in about 75 to 90% of subjects with allergic asthma, and over 20% of kids with rhinoconjunctivitis develop asthma later in life. So we tend to think of that as something we call the atopic march, where the rhinitis starts and then eventually over time the asthma starts kicking in. So what are the disorders that respond to inhalant immunotherapy? Dr. Metz went over some of these things. So allergic asthma, whether it's seasonal and perennial, allergic rhinitis with allergic asthma, allergic rhinitis with or without conjunctivitis, so that includes both seasonal and perennial. And what are the considerations for allergen immunotherapy? So one, if you've got an inadequate or partial response to environmental control and medications, if you still have persistent symptoms on both a seasonal and perennial basis, if you have a side effect related to medication use, and especially with cost burden with chronic medications, because a lot of times these patients are on an antihistamine, a nose spray, an inhaler, both or rescue and controller, and eye drops. So there's a lot of different medications that can be involved. So definitely a cost burden with that. And also non-compliance with medication regimen. Because I find, if you give quite a few different things, it just makes it a lot harder, obviously, to be compliant and using it on a regular basis. So I think that has certainly been an issue for a lot of our patients in a multi-drug regimen. It's definitely hard to keep that on a regular basis.